Everyone. My name is Christina Bordignon, and today I'll be presenting an evidence-based overview of nutrition and psoriasis with a focus on two widely used natural product supplements, omega-3 fatty acids and curcumin. My goal is to provide clear, research-supported information that helps the public make informed decisions about complementary therapies for psoriasis. I'll walk through the disease background, summarize clinical trials, and end with practical recommendations. Let's get started. Skin diseases are some of the most common chronic conditions in the United States. They range from inflammatory conditions like eczema and psoriasis to infections or autoimmune diseases. These conditions don't just affect the skin, they influence emotional health, social functioning, sleep, and overall quality of life. The burden is significant in both healthcare costs and lost productivity, and many individuals seek complementary therapies alongside traditional treatments. When we zoom in on the impact, we see that chronic skin diseases often lead to visible symptoms like redness and scaling, which can affect self-esteem, mental health, relationships, and daily life. There are also financial impacts, such as repeated doctor visits, prescriptions, and specialty treatments, which can add up. Because of this, many patients explore additional options, including nutrition-based therapies, with the hope of reducing inflammation and improving symptoms. Psoriasis is a chronic immune-mediated skin disorder characterized by thick red plaques with silvery scales. Diagnosis is usually clinical, based on appearance and distribution. The Psoriasis Area and Severity Index, or PASI, is commonly used to measure disease severity. Conventional treatments range from topical corticosteroids and vitamin D analogs to phototherapy, transfusions, oral medications, and biological therapies for moderate to severe disease. Even with these treatments, many patients still look for additional, more natural approaches to manage inflammation. Psoriasis affects approximately 3% of adults in the United States, which translate to over 7.5 million people. It affects men and women equally, and although it can occur at any age, it often begins in early adulthood. Up to 1/3 of individuals with psoriasis may go on to develop psoriatic arthritis, which involves painful joint inflammation. The impact on quality of life is substantial, and this is part of the reason why complementary therapies, especially nutrition supplements, are widely explored. Psoriasis is driven by an overactive immune response. The key pathways involve T cells and cytokines, particularly interleukin 17, interleukin 23, and tumor necrosis factor alpha. These cytokines promote rapid skin cell turnover and chronic inflammation. Because inflammation is central to psoriasis, researchers are interested in nutritional therapies that may modulate these pathways, specifically anti-inflammatory agents like omega-3 fatty acids and phytochemicals like curcumin. Omega-3 fatty acids, particularly EPA and DHA, are nutrients found in fatty fish and fish oil supplements. They have well-established anti-inflammatory effects, including altering eicosanoid production and lowering inflammatory cytokines. Public interest in omega-3 supplements is high, which is why many clinical trials have been conducted to see whether they improve psoriasis symptoms. Our first trial is a 2020 randomized, double-blind, placebo-controlled trial involving 64 adults with plaque psoriasis. Participants received either hearing roll oil, a phospholipid-rich omega-3 formulation, or placebo daily for 26 weeks. The study found a statistically significant improvement in PASI scores at 26 weeks, especially for individuals with mild to moderate baseline disease. The supplement was well tolerated with no serious adverse events, and although the effect size was modest, the study supports the idea that certain specialized omega-3 formulations may offer benefit. This double-blind, multi-center RCT tested intravenous omega-3 lipid infusions in adults with chronic plaque psoriasis. Although the IV route is not practical for everyday use, the study is historically important because it demonstrates improvements in some clinical measures compared to placebo. However, results varied between study centers, and the method of administration limits its applicability to routine outpatient care. This open randomized controlled study looked at 200 patients with mild to moderate plaque psoriasis. The intervention group took 1.8 grams per day of omega-3 fatty acids along with topical paraffin, while the control group used paraffin alone. After 12 weeks, quality of life scores improved significantly more in the omega-3 group, and a greater number of participants achieved a PASI 75, indicating substantial clinical improvement. The supplement was generally well tolerated, though a few minor gastrointestinal effects were reported. This study suggests that oral omega-3s may improve both symptoms and patient-reported quality of life. Okay, so let's talk about these three studies. When we look across these studies, the evidence for omega-3 supplementation in psoriasis is generally mixed. Some trials show improvements in PASI scores or quality of life, while others show limited or inconsistent results. Newer formulations like herring roe phospholipid omega-3s appear more promising than traditional fish oil capsules. Safety is generally excellent, but caution is needed at very high doses, typically above 3 to 5 grams per day, especially for individuals on blood-thinning medications. Overall, omega-3s may offer modest benefit for some individuals, but they are not reliably effective for everyone. Okay, let's take a look at our next therapy. So curcumin is a phytochemical derived from turmeric. It has strong anti-inflammatory and antioxidant properties and can downregulate immune pathways like NF-κB and key cytokines involved in psoriasis. Because curcumin has poor natural absorption, many studies use specialized formulations to enhance its bioavailability. It is used both orally and topically in psoriasis research. All right, if we take a look at our first study, it's a randomized placebo-controlled trial that evaluated Mariva, which is a bioavailable phospholipidated form of curcumin. This is an add-on to standard topical steroids. Over approximately 12 weeks, patients receiving curcumin plus topical therapy had a greater PASI improvement than those using topical therapy plus placebo. Importantly, curcumin significantly reduced serum IL-22, which is a cytokine strongly linked to psoriasis activity. This study suggests curcumin may enhance the benefits of conventional treatment rather than replace it. Okay, our next study is a double-blind, placebo-controlled clinical evaluation with 34 adults with mild to moderate plaque psoriasis. They used 0.5% turmeric microemulgel on one side of their body and placebo gel on the other side for 9 weeks. The curcumin-treated lesions showed significant greater improvements in redness, scaling, and plaque thickness. Dermatologist scoring also revealed earlier and more consistent improvement. There were no major side effects, aside for some temporary yellow discoloration on the skin. Although small, this study provides evidence that topical curcumin can be effective for localized psoriasis lesions. Okay, this last trial is a prospective open-label trial examining high-dose oral curcumin, which is 4.5 grams per day, in individuals with moderate to severe psoriasis. Many participants showed clinical improvement over 10 weeks, and the supplement was well tolerated. Because the study lacked placebo control and used an older formulation, the findings are considered supportive but not definite. Taken together with the previous RCTs, it contributes to the overall body of evidence that curcumin may have therapeutic potential. Okay, to summarize the three studies, the evidence for curcumin in psoriasis is more consistently positive compared to omega-3. Across multiple randomized trials, both oral and topical curcumin formulations have shown improvements in symptoms, inflammatory markers, or both. However, effectiveness depends heavily on formulation. Curcumin absorbs poorly unless combined with phospholipids, micelles, or other enhancers. Curcumin is generally safe and well tolerated, making it a viable adjunctive therapy for individuals seeking natural options. When we compare the two therapies directly, omega-3 fatty acids have mixed and sometimes modest results. Some studies demonstrate benefit, but not others. Curcumin, on the other hand, shows more consistent improvement, particularly when used with appropriate formulations or alongside conventional treatments. Both therapies are safe for most individuals, but neither should replace prescribed psoriasis treatments. Instead, they may be used as complementary approaches. Here are clear, practical recommendations for individuals considering these supplements. As for any complementary nutrition therapy, always talk with your clinician before starting any supplementation. For omega-3s, aim for doses used in clinical trials, typically between 640 milligrams and 3.5 grams per day by EPA and DHA. Always choose third-party tested products and speak with a healthcare provider if you take blood thinners. For curcumin, use a bioavailable formulation such as phospholipidated or micellar curcumin. Follow dosing instructions on the product and use it as an adjunct, not a replacement, for standard treatment. Stop either supplements if you're experiencing any unwanted effects, and always consult a healthcare provider if any of those symptoms arise. When selecting omega-3 or curcumin products, it's essential to look for third-party testing such as USP, NSF, Consumer Lab, or Informed Choice. These certifications confirm that what's on the label is actually in the bottle. Avoid products with vague proprietary blends since you can't verify the amount of active ingredients. Always discuss supplements with your clinician, especially medications, and choose brands that use good manufacturing products, clear, transparent labeling. These steps help ensure you're using evidence-supported therapies as safely and as effectively as possible. Several other complementary options are being explored for psoriasis, including vitamin D supplementation, probiotics that may target the gut-skin axis, B12 topical preparations, and aloe vera gel. Mind-body practices such as mindfulness, relaxation techniques, and cognitive behavioral therapy may also help reduce flare-ups, especially because stress is a major trigger for many people. These approaches can be supportive additions to comprehensive psoriasis management plan, and there's also additional information on these websites. Recognize the limitations of the research. Many studies have small sample sizes, short durations, and varying supplement formulations, especially with omega-3s and curcumin. Supplement quality varies widely since these products are not as tightly regulated as prescription medications. My message to patients is this: complementary nutrition therapies can be helpful, but they work best when integrated with traditional treatment and under the guidance of a healthcare professional. All right, these are the major references used in the presentation, including the 6 clinical trials I discussed. Thank you for your time.